Erectile dysfunction is an inability to obtain an erection satisfactory for sexual activity or for intercourse. Unfortunately, erectile dysfunction is more common than we'd like to think. It can affect men in all ages, and it can actually start pretty early in life. There are multiple causes for erectile dysfunction, and the majority of the time we're able to identify the exact etiology or cause. The more common causes, of course, are diabetes, heart disease, medications, smoking, yes, previous surgery, and that includes prostate surgery. Erectile dysfunction is generally a subjective diagnosis. It does depend on the patient and the patient's response and the quality of their erections. There are tests that we can do, maybe a little bit more invasive tests to really kind of make a diagnosis, really figure out why a guy has erectile dysfunction. We do use imaging studies, we'll use medications, things like Doppler ultrasounds and penile injections. Yes, some erectile dysfunction can be prevented. That includes a healthy lifestyle. That includes knowing the risk factors for erectile dysfunction. That includes getting into men's health clinics early and being evaluated and treating early. But yes, also, unfortunately, not all erectile dysfunction can be prevented, especially if it's secondary to other medical problems or comorbidities or medications or traumas or surgeries. When you see a specialist for erectile dysfunction, it often starts off with a complete history and physical. And yes, you look for identifying factors or contributing factors, behavioral modifications or medicine changes or modifications that you can make. Then it does include some trial and error, maybe trying some treatments and working your way through. It also includes when to do, more invasive procedures, diagnostic studies, and of course working with the male and deciding what's right. You have multiple treatment options and multiple things that you can do. You've just got that ability to reach for different things. Well, this is the good news, and this is the exciting part, that there is treatment options. And that does include medications as well as vacuum erection devices or injection therapy in the penis. There's even a suppository that you can put into the urethra, and of course the penile implant. And there's a couple of options for penile implants. As you go through this process with your men's health specialist and physician, you'll determine what's right. You'll find the right thing for you. It depends on your lifestyle. It depends on your sexual activity. It depends on what you want to do and what your goals are. Satisfaction rate includes both the patient and the partner. Let's not forget about that. So yes, oral therapies can be very successful. A vacuum erection device, it can work. Injections can work. When we look at the success rates, including satisfaction rates with something like the penile prosthesis, we're talking 90+% for both the patient and the partner. And again, let's not forget about that. Unfortunately, there is data that shows the longer we go without erections or fullness of the penis can result in penile scarring and penile shortening.